What causes arthritis in the hip? What are the symptoms of arthritis in the hip? I'm Rhodri Williams, a consultant orthopaedic surgeon at Werndale Hospital. I specialise in the treatment of hip arthritis. In this video, I'll share everything you need to know about arthritis of the hip and how to manage it. We'll cover what causes hip arthritis, the symptoms to look out for, the non-surgical treatment that can help, and the surgical options available if your symptoms become more severe. The aim is to help you understand what's going on with your hip and what the next steps might be. So let's get into it. What causes arthritis of the hip? Hip arthritis is a condition where the smooth cartilage that lines your hip joint gradually wears away. Your hip is a ball and socket joint, designed to move smoothly and comfortably, but when the cartilage becomes damaged or thin, your usual movement can become painful and stiff. The most common type of hip arthritis is osteoarthritis. This tends to develop slowly over time and is often linked to age-related wear and tear, although it also can affect younger people. Young people are most likely to develop hip arthritis if they've had previous hip injuries or underlying hip problems earlier in life. In some cases, inflammatory conditions such as rheumatoid arthritis can also affect your hip joint. What are the symptoms of arthritis in the hip? The symptoms of hip arthritis often start subtly and become gradually worse over time. Many people first notice pain in the groin or the front of their hip, particularly when walking or standing for long periods. Stiffness is another common symptom, especially first thing in the morning or after sitting still for a while. As arthritis progresses, the pain can affect your thigh, buttock, or even down to your knee, which can be confusing. This is known as referred pain. In more advanced cases, hip arthritis can cause pain at night, disturbed sleep, and a noticeable reduction in your mobility, all of which can have a huge impact on your day-to-day life. What are the non-surgical treatments for hip arthritis? In the early and moderate stages, hip arthritis can often be managed without surgery. The focus is on reducing your pain, improving your movement, and helping you maintain your independence, all of which are very possible. Lifestyle changes can make a real difference. Managing your weight helps reduce the pressure through the hip joint, and adjusting your activities can prevent unnecessary flare-ups. Focus on low-impact activities such as walking on flat ground, cycling, swimming, or gentle stretching to keep your hip moving without overloading the joint. Strengthening the muscles around your hip and maintaining gentle, daily movement can reduce stiffness and help protect the joint. Physiotherapy is often very helpful alongside this. It is a highly specialised treatment that involves guided exercise and soft tissue work to ease pain and improve movement. When followed consistently, a physiotherapy programme can make a substantial and long-lasting difference to your comfort, confidence and overall quality of life. Pain relief medications and anti-inflammatory medication might also be used to manage your symptoms. In some cases, steroid injections into your hip joint can help reduce inflammation and pain, although their effect is usually temporary. The hip injection is often mixed with a local anaesthetic and injected directly into the painful area to calm inflammation and swelling. For hip pain or arthritis, the injection is usually placed into the hip using ultrasound or X-ray guidance to ensure accuracy. These treatments don't reverse arthritis, but they can significantly improve your comfort and function. In some cases, they can keep your symptoms at bay for months or even years at a time. What surgery can treat arthritis of the hip? When non-surgical treatments are no longer effective and hip pain is significantly affecting your quality of life, surgery may be considered. The most common and successful surgical treatment for hip arthritis is a total hip replacement. Hip replacement surgery involves replacing the damaged ball and socket of your hip joint with artificial components designed to move smoothly and reduce pain. For many patients, this operation can be life-changing, allowing them to return to activities they've had to give up because of pain. In a partial hip replacement, only the damaged ball at the top of the thigh bone is replaced, while the natural hip socket is left intact. This is most often used for certain hip fractures. In a total hip replacement, both the ball of the thigh bone and the hip socket are replaced with artificial components, which is commonly performed for arthritis or widespread joint damage. The decision to proceed with surgery is based on symptoms rather than X-rays alone. If pain, stiffness and loss of mobility are limiting your daily life, surgery may be an appropriate option. Recovery after a hip replacement is often a very positive and rewarding process, as many people notice a significant reduction in their pain and a steady return to comfortable movement compared with before surgery. In the first weeks, walking becomes easier with support, and daily tasks such as standing, sitting and sleeping gradually feel more natural as your strength and confidence improves. With guided exercises and physiotherapy, your mobility and muscle strength will continue to build, allowing you to return to enjoyable activities like long walks, social outings and light exercise. By a few months after surgery, many patients report improved independence, better sleep and a renewed sense of freedom. If you're experiencing hip pain or stiffness and think arthritis might be the cause, getting an expert assessment can really help clarify your options. At Circle Health Group, the UK's largest independent hospital group, we're here to help. To find out more about hip arthritis, available treatment options, or to book a consultation with a specialist, you can visit the Circle Health Group website using the link in the description below. Thank you for watching, and if you have any questions about hip arthritis or suggestions for future videos, please leave a comment. You can also explore more videos on our channel for trusted medical advice.